There is this article from Aveling and colleagues. It's Quality Improvement Through Clinical Communities, 8 Lessons for Practice, published in the Journal of Health Organization and Management. This article is a synthesis of a wide range on literature that tells us how to use networks to help improve clinical outcomes, to bring about more clinical integration. And this article gives us 8 main lessons on how to facilitate the implementation of networks in achieving these goals that I've just mentioned. So if we look at the first lesson that is found in this article, and before I go further, they use the term clinical communities. Now, clinical communities are similar to clinical networks. If you look at the definition, it says it's a specific type of network whose members are interdependent in the sense that they share a common commitment. They share common commitments to specific quality improvement goals and work collaboratively to achieve these. Now, they differentiate between networks that are for achieving certain quality improvement goals. They differentiate between those and networks that are for other purposes such as research and so on. But when we talk about quality improvement, we're mostly talking about clinical outcomes. We're talking about improving the integration on the clinical side, so clinical integration. So this article is relevant for this topic, and it gives 8 main lessons on how to achieve these. Obviously, we're not going to go into a whole lot of details about what the content of this article, but there is a few points that need to be made. So one of the points that should be highlighted in lesson 1, for instance, they said that it's important to have some sort of structure to the network, and so having some amount of hierarchy and a bit of structured coordination mechanisms. Also, they talk about the need to have a trusted leadership. So if you're talking about in the case that we've discussed about geriatric, the network between geriatricians and cancer specialists, for instance, this article would suggest to help in implementing, in solidifying this network between cancer specialists and geriatricians. So a trusted leadership from both parties that will help and facilitate and consolidate the steps that were taken to build the network. They also mentioned the need to have advocates from different professional groups. So to allow all the professional groups to have someone who speaks for them, who comes and brings their perspective to the table. So that's important, among other things. So some hierarchy, some coordination mechanisms, a trusted leadership, and also advocates from different professional groups. Now, another lesson that is found in this article is one that relates to having a methodology for achieving the improved clinical outcomes or the increased clinical integration. Having a methodology, a clear-cut methodology. So it could be that the methodology would be the dissemination of more clinical guidelines that will help in structuring how patient care is conducted, or it could be the delivery of more educational sessions to educate different professionals on how they could benefit from working with other professionals, for instance. But having this clear method that is sort of articulated ahead of time is important, but allowing for flexibility also is important in case on the ground some changes are required to the approach that is taken. So, for instance, in the case of the geriatricians and the cancer specialists, so the initial methodology from the part of the geriatricians was to create more exchange with the oncologists through inviting them on collaborating on research projects, or creating lecture series that would setting up lecture series that would be about topics at the intersection of oncology and geriatrics. So seeing whether this approach was successful or not, this article from Aveling and colleague would say that based on what you observe in trying to set up the network, you should adapt accordingly and see. So if something is working, to do more of it, or if something is not as successful, using other approaches. So in our case, the geriatricians came to the realization that instead of just the lecture series or the different research projects that they were trying to propose to cancer specialists, co-location would be something extremely important. So creating opportunities to spend more time together and actually having the offices closer to each other. All of these were things that they came to realize as they tried to form the network. Another point that is mentioned in the article is one that relates to having the right resources and training. So the article mentions the importance of having political support, having top-down input that shows that not only the initiative has the support of the upper levels of the organization, so that gives legitimacy to the initiative, but also financial support is important. In terms of legitimacy, in the case of the Geriatric Oncology Network, the head of the Cancer Treatment Center sort of provided some one might say moral support to the initiative, but they weren't really forcefully advocating for it, and that was a handicap and was something that was missing in helping to facilitate the formation of the network. And another point that in the article from Aveling and his colleague, that's the fourth point, he talks about the importance of addressing power inequalities and making sure that some groups are not marginalized. When we talk about interprofessional networks, power oftentimes has a big influence on how the relationships are on the power has an influence on the relationships. For instance, some groups might feel marginalized, and that will be a big impediment to the solidification or the sustainability of a network. So they talk about the importance of making sure that the less powerful players are not marginalized. They also talk about the importance of using scientific evidence in trying to help hold the community together and reduce conflict. Because oftentimes clinicians are very sensitive and pay attention to scientific evidence, and that's one way to influence professional practices. Now, another point, the fifth point that's found in the article, is the importance of fostering a sense of community. Fostering a sense of community, that means creating ongoing opportunities for interaction and communication between the different parties, allowing for informal socializing. Okay, so having time for coffee breaks and the likes to allow for more contacts between the members of the network, and also having knowledge brokers, boundary spanners. These are people who try to create sort of bridges between different specialties. And oftentimes there are different subcultures in a healthcare organization. So certain specialties have a way of doing things. They have particular vocabulary, a certain language for talking about certain things that are different from peers in a different specialty. So a boundary spanner would be one that allows these different specialties to understand each other and to be able to more effectively work together. And another lesson also that is found in this article is the importance of using data. Data can help in motivating participants to action. It's one way of also providing feedback on performance and creating accountability. All of these things are extremely important. So, for instance, in the case of a hospital, one could use data about infection rates and tell the different parties involved in that network. That there's a need to reduce infection rates by a certain to a certain level, and sort of motivate them to use this data to guide their action and to continue progressing towards a particular goal. And there's also a point about finding the balance between hard and soft tactics. I've mentioned earlier that in the case that we studied with the geriatric oncology network, it was the soft tactics were used for creating this network and sustaining it. But sometimes harder tactics are needed to overcome resistance, inertia, and internal competition. And like I said before, oftentimes the harder tactics, the ones that are requiring more imposition of things, are less successful with professionals because they have a lot of autonomy in executing their task, and they often have also considerable power. And lastly, the article mentions the importance of recognizing the importance of context. Okay, context is important, and one should always adapt their approach to the context in which an action is implemented. So in creating these communities, these interprofessional networks, it's important to understand the context in which these things are happening, and adapting one's actions in the establishment of the network, and also in trying to sustain the network, to adapt one's approach to the context.